Oops. Is it on? Yes,
Yep.
it is on. Green means on, correct? Okay. All right, good afternoon. It's a pleasure to be here talking about something I care very deeply about, and that is adolescents and children and their ability to succeed in life, as well as school, as well as in growing up healthy. So I've been asked to talk about public health and school-based health care, and I punctuate that with saying that it matters, meaning that public health is an important part of school-based health care. And I hope by the end of this conversation, or this presentation rather, I will have convinced you of that. So first of all, let me start by going over the fact that for the first time ever in the Healthy People Objectives, there is a specific objective about graduation. And it reads that we will increase the proportion of students who graduate with a regular diploma 4 years after starting 9th grade, which is significant that in a health policy document, there's an education objective, and it's very specific that it's set in that it states that they would have a regular diploma and 4 years after starting 9th grade. So that's pretty specific in terms of what's expected. Furthermore, it's a graduation, on-time graduation is considered a leading indicator of adult health, both adult health status as well as adult health behaviors. So that's pretty significant in this document that guides the delivery of millions of dollars of resources in this country. So we take it pretty seriously at APHA and believe that graduation is a public health priority. And we have our own policy that speaks to that priority, and that we will work collaboratively between public health and education and other sectors to improve high school graduation as a means of eliminating health disparities. So at the Center for School Health and Education, which I'm the director of, we see our role as advancing school-based healthcare as a comprehensive strategy for preventing school dropout and improving graduation rates for the K-12 population. So why in public health? Well, public health refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole, which is a major distinction for public health. Its activities aim to provide conditions in which people can be healthy and focus on entire populations, not on individual patients or diseases, which is a significant difference when you compare it to the delivery of primary care. This is a distinction with public health. Thus, public health is concerned with the total system and not only the eradication of a particular disease. So what are the strategies embedded in public health? They include surveillance, prevention and wellness strategies, the implementation and evaluation of solutions, raising awareness, educating and informing, developing and assessing health and education policies, so not just looking at the problem itself, but looking at systemic issues and solutions, and building and doing this work through networks and partnerships, which is another significant distinction for public health. In other words, public health aims to get to distinguishing the symptoms from underlying causes, okay? And then once distinguishing that, making sure the symptoms are addressed, of course, but more importantly, reaching deeper and looking below that to what are the underlying causes. And again, applying these strategies to those underlying causes. So let's unpack school dropout. The focus of the center is on dropout prevention. And as good public health folks, we know that if we're going to talk about an issue, we need to understand why the problem exists in the first place. So when you begin to unpack school dropout, this illustration begins to capture some of the issues that surface when you unpack it. You find that young people have been or are abused, they're hungry, homeless. You have a lot of sadness and some of the other issues that are reflected in this particular illustration. Actually, these are factors that one can say are associated with poverty. And indeed, consider this. 51% of the students attending public schools today, over half of the young people attending public school today are low income, living in poverty or low income. That was for 2013. Contrast that to in 2000, there were 38%, and in 2011, 48%. Well, in 2013, over half of the young people attending public school are considered low income and or living in poverty. When you further examine high school dropout and or being pushed out, when you talk to young people, first of all, that almost half of the young people who drop out are males and approximately half are females. But the reasons are different. And so it's important to understand it from a gender perspective, particularly if you're going to strategize around keeping them in school, they need to be gender specific. Your strategies need to be gender specific. So for young men, the reasons tend to be around disciplinary issues, having to earn income, poor academic performance, absenteeism, which could be related to any one of those other items above, as well as school disengagement. Whereas for young people, for females, the number one reason for young girls dropping out of school is no surprise, an unplanned pregnancy. And then having to parent or provide care to some other member of that household, go to work for income, or having been harassed in school or on the way to and from school. So again, important information in order to really address why some of the reasons from a public health perspective, young people are dropping out of school. Diving a little bit deeper, and one of the major functions of public health is to do needs assessment and understand, do a scan of what's going on in that community, what's going on with the young people, and looking at the data again from a population perspective. So this data comes from a school that we have worked with in an urban part of this country. We looked at high school and middle school, and we asked a number of questions, and we did it in a way that increased reliability and validity of the data. So we feel pretty strong that this is actually what's going on. It was administered on a tablet and or a laptop, and it was self-administered, which is real important because we know that if an adult is asking those questions, they're going to give them the answers they want, they believe the adult wants to hear. So the fact that this is being self-administered on a laptop and or a tablet increases the reliability as well as the validity and the accuracy of what's being reported. So what you see before you are the findings of, again, one middle school and one high school where we were piloting a program. And I highlighted the issues that are in red because they are directly related to whether or not that young person attends school, stays in school, present, focused, ready to learn. And again, our agenda at the center is improving graduation rates. So we're really honing in on why kids don't graduate, okay? And so you see the issues laid out in front of you. Some of them are pretty alarming when you think about the fact that half of these high school students are having sex, and half of those are not, a quarter of those are not using any protection. So the pregnancy is not a matter of if, it's a matter of when it happens, right? Carrying a weapon, but interestingly enough, when you dig deeper, you find out one of the reasons that they carried a weapon is because they felt unsafe going to school or coming home from school. So they were doing it to protect themselves to and from school, as opposed to what we often think about with young people carrying a weapon, that they're ready to start some trouble. Well, the reality is they're trying to protect themselves from trouble. And so the strategy is very different and shows the importance of not only ascertaining the information from young people directly, but then digging deeper to find out what's behind the numbers, right? Got in trouble because of anger, you see there for middle school and high school kids. But my point for this slide really is to show you what some of the social factors in urban schools are that are challenging not only the ability for young people to be healthy and practice good behaviors, but also succeed in school. This particular assessment also looked at some other issues associated with poverty. As I said earlier, 51% now, and that's been growing over the last several years, of these young people enrolled in public schools are living in poverty or low income. So it's important to understand what are the factors associated with poverty, or how it's defined, because often we roll poverty up into this bucket and we don't unpack it to understand so that we can really address it. this is a particular virtue of public health as well. We find homelessness, intermittent electricity, so it's off and on, intermittent running water, hunger, and literacy is an issue, of course, caregiving responsibility either for a child or for an adult in the household, poor grades, being in an abusive data situation we're asking about, and undiagnosed health conditions, particularly asthma. My point, and another key point about ascertaining this information is if you don't ask, they're not going to volunteer this. These are all issues that carry some stigmatization or embarrassment, and they're not going to come and say, oh, teacher, or health provider, guess what? I'm homeless. Nah, it's not going to happen. So you have to, again, a strength of a needs assessment and a fundamental factor in public health is getting this kind of information so that you can really strategize around those underlying causes. Poverty, okay, as I said, 51%. Why is it important to think about that? Well, it's a principal pathway for other issues. Physical disease results in elevated chronic physiological stress. Relative to their more advantaged peers, low-income children have more sympathetic nervous activity, for example, elevated blood pressure, elevated hypothalamic pituitary adrenal axis activity, which results in dysregulated cortisol, as well as it's associated with obesity and also having a compromised immune function. So it's important to understand that poverty is a pathway to these other issues, and it's important to understand why we have to get to poverty and unpack it and then respond to it. So this is a illustration from a colleague of us, Dr. Kamara Jones, and we adapted this from her original piece to distinguish for you public health and primary prevention, which looks at these factors and tries to go upstream, right? And you'll see and prevent these issues from even surfacing, definitely from manifesting. And by going upstream and pushing back from the cliff. This analogy, as she describes it, is a cliff analogy. And you have clusters of people representing the population. You have the cliff. You have something preventing. Is this moving? Yes. Preventing them from getting to the edge of the cliff and then falling off of the cliff. We have our primary care represents and our safety net providers. We would consider secondary prevention. And then at the bottom of the cliff is where we have tertiary, or we have hospital emergency services. We need all of these in our health system. Every single one of them is strategic and plays an important role to the health and well-being of people and populations. The focus of public health, however, is responding on these social environmental factors. A few I alluded to. I could go on much deeper had I more time, but I alluded to some of them, of what's going on in the lives of young people, both in their interpersonal relationships, as well as their families, as well as communities, and in the schools. And public health's primary focus is on preventing those kids from getting to the edge of the cliff and falling off the cliff, and hopefully minimizing what happens when as they're going down. And we also know that some young people are going to slip through the safety net and hit the bottom of the cliff and have a need for emergency services. So our focus at the center and in public health is on prevention, primary prevention. So what's the evidence on school-based health centers? First of all, we know, and this is all available on our website in terms of the studies. We know that sexually active adolescents were more likely to accept and use contraception when it was provided by a school-based health center. Students, teachers, and parents who have a school-based health center rated academic expectations, school engagement, safety, and respect significantly higher than in schools without a school-based health center, where primary care and public health were being provided. The mere presence of a school-based health center positively impacts the overall school climate and learning environment. These are all very significant findings as it pertains to school-based health centers. They also attract harder to reach populations, especially racial minorities and males. And when we talk about preventing dropout, that's a significant and important feature because the primary population that's dropping out is either black or brown and tends to be males. About split, but you'll find in some communities heavier on the males. School-based health centers do a better job of getting young people into services such as mental health care, which, as we all know, still remains stigmatized in our society, doing risk assessments, as the one I described to you a few minutes ago, and early intervention and primary prevention. Adolescents were 10 to 21 times more likely to come to a school-based health center for mental health services than a community-based health center. And then when you look at some of the educational indicators and school-based health centers, they decreased have results in terms of absenteeism, which is an important educational indicator, reducing it by 50%, tardiness reduced by 25%, increased grade point average, and African American males, and again I isolate them because of the dropout data, were 3 times more likely to stay in school when there was a school-based health center. And then there's some early infinite evidence of having an impact on school suspensions as well. So, firstly, let me just point out in my little cartoon there that it takes both school-based health centers and school nurses to make a difference in the lives of young people and to keep them in school. School-based health centers have a little bit of an edge in some ways. School nurses have another edge in other ways. But together, they're at the intersection of health and education. And that's it. I want to stop there. So I should be right about on time. Is that right?
Yes.
Okay. So questions at the end? Is that the way you're handling
Yes.
it? Okay. Thank you very much. Oh, and I need to pass this on to you.
Thank you.
And here's the clicker.
Great. Thank you.
Okay.